Recognize the gentlewoman from California, Ms. Lee, for 5
Thank you very much, Mr. Chairman and our ranking member, for having this important hearing, and thank you to all of our witnesses. First of all, it seems like it's lost on Republicans that one of the major outcomes of the rescue plan is we save lives and livelihoods. And if that's not important, I don't know what is. People are alive because of that. People are surviving and beginning to thrive because of the rescue plan. And that's bottom line. And also, let me just say, I very clearly remember Reaganomics. The rich got richer and the poor got poorer. And every time I see a homeless veteran, I think of Reaganomics. And so I know what Reaganomics did, especially for low-income people and people of color. Let me ask you, anyone can answer this. I'd like to hear from all of our witnesses in terms of low-income communities, the issues around income inequality and structural racism. People were living on the edge before the pandemic. People were barely surviving. And I know for people of color, the structural racism and the issues around income inequality is why. And so I'm wondering now, the structural issues, the institutional issues, the policy changes that are necessary so that people don't fall back into those same old systems. Did we address any policy changes, any of the structural issues so that people who've been living on the edge can move forward now and not have to go through the same rigmarole that they've had to go through because of their race or because of their economic status?
Thank you. I'll dive in. I've been Black all my life, and my city certainly is predominantly African American, as I stated, 88%. And what I do want to say is, I must say this. I take issue with being referred to as delusional, because I work in my community day in and day out. I'm in the streets each and every day, making sure that families are moving towards being better. But one of the things that I can say that we used and chose to use the money in a deliberative fashion in my community was seeking and making sure that our community had a voice in some of the things that we would do to get the best bang for the funding that we received. It is rare and unprecedented in my lifetime that the federal government gave grants to every and so many units of local governments. At the same time, the city, we knew there were critical investments that had to be made to stabilize our community, to afford all of our members of the community. I don't operate Republican or Democrat as a mayor. I don't have that luxury. So I'm a little concerned of the conversations that we're having because it seems like I might be in the wrong room. But I do know what I have been focusing on is to uplift my community and those communities that I serve, but also working with the members of the National League of Cities that we serve over 19,000 cities, towns, and villages, which provide service to over 200 million people, and many of those are people of color. So certainly this has been a great opportunity, and it still is a great opportunity for us to do more. People are getting back to work. We have an unfortunate situation because of COVID-19 pandemic. Stressed supply chains have been a big problem, and we know that. But I am very concerned that this conversation is shifting in another direction. But, ma'am, thank you, and I hope that helps you.
Thank you. And Ms. Farrett, could you also respond in terms of not just providing more resources, but are we changing those systems that are barriers for people of color and low-income people?
Yeah, thanks for the question. I think that the American Rescue Plan did a lot to push against the spike in hardship that we would have seen that would have disproportionately fallen on communities of color that have for centuries faced systemic racism, which is why they came into the crisis with fewer assets, lower income, more vulnerabilities to both the virus itself and the economic fallout. But temporary measures can't solve permanent problems. And one of the things that's, I think, important and exciting is that we tested some things that worked that could push back in a more systemic way and that really paint the way or pave a path for the future. I think of it as the need to invest in 3 areas: our kids, our workers, and our healthcare. And in each of those areas, communities of color face systemic barriers that hold them back in ways and make them less likely to achieve their full potential and to thrive and to be able to chart their own destiny, right? So we need to invest in our kids, because when we invest in our kids, when kids have more economic stability, when they go to good quality schools, when they have adequate nutrition, when those things happen, kids thrive and they can succeed. And so that's why I talk about expanding the child tax credit permanently to make it fully available to kids who need it most. It's why we need to invest in childcare so that families can work and kids get the help they need to develop. When we think about investing in workers, we know that in a dynamic economy, people lose jobs. But in the United States, a temporary job loss can be an absolute financial crisis for a family because our unemployment insurance system creates so much financial insecurity for people. And the third thing I would say is healthcare. We have 2 million people in the United States, 2 million people who should be getting Medicaid coverage that provides comprehensive coverage, including mental health coverage, acute and long-term care. They should be getting Medicaid, and they aren't. And the reason is because their states, like the state of Georgia, has refused to adopt the Medicaid expansion. And that means that we have, of that 2 million people, 60% are people of color, systematically left out of healthcare coverage that they need to be able to thrive and support their families. So we know what we can do. We know it can make a difference. And the question is whether we'll take those steps to get it done. Thank you.